Every patient with ongoing stroke symptoms within the last 24 hours gets a call to our stroke team. And actually I've got one right now, so let me answer my stroke page. Hi, is Dr. Grossman available? This is Dr. Khatri. Hey there, can I ask you a favor if you're not in the middle of a case? He's having left body symptoms. Thank you, I really appreciate it. Okay, bye-bye. That's the thing about having a team, right? Because like even as experienced as we are, we all check with each other about everything because we know that it's complicated. Starting in '96, we were giving a medication through an IV called TPA, and that breaks up blood clots through the bloodstream. With endovascular therapy, what we're talking about is taking a wire up through the artery in the leg, all the way up to the brain, and actually pulling that clot out. With the latest advancements in these procedures, those clots are being taken out about 80% of the time when we try to do it. Now we're at a point where we can actually reverse some of the worst strokes if we can get them early enough. So that's really exciting. You know, there'll be a patient, a common syndrome is they're not talking, they're not understanding us, they are completely paralyzed on their right side. And we take them down to the angio suite. My colleagues will get the clot out usually within an hour, more often these days less. And then a lot of times on the table, the patient will start moving, will start talking, asking questions. And it's fascinating because sometimes they'll tell you what they were trying to tell us.
During this hospital stage, we're looking for what caused their stroke. The patient we just saw, we don't really know what caused their stroke, but we think it might have been coming from the heart, so we're going to recommend putting a heart monitor in to look for heart rhythm issues that could generate clot, that could go to the brain. I'm going to head down to the emergency department now to see Dr. Adeoye. We work together actually as co-directors of the stroke team. He comes from the emergency medicine side, I'm on the neurology side, and we're both specialized in stroke and actually both do acute stroke trials as well, but I'm going down to talk to him about a patient.
What we do in stroke care is a multidisciplinary endeavor between basically starting in the pre-hospital environment through the emergency department, involving neurology, involving radiology, involving either neurosurgery, radiology, or neurology for neurointervention. And so it's critical to be able to communicate with all the people that are potentially involved in the care in order to make sure that we deliver optimal care for the patient. To that end, what we've done in Cincinnati and at UC specifically for over 30 years now is worked very closely together. Dr. Khatri and I, we've worked together for over 10 years at this point. We know each other well, we know how to communicate effectively with each other, and that all adds up to, for the individual patient who rolls in, by being able to pick up the phone and talk directly to the neurologist on call or the interventionist on call to make sure that the patient gets optimal care.